We all have a story. Your story is not my story, and my story is not yours. However, we can find joy, hope, and emotional healing even through our most painful moments in life. Let's walk and take this journey of healing together, one step at a time, because your story does not define you. It's beautiful, people. It's a beautiful day always, even when it doesn't feel like it. We made it another day, and God's grace and His mercy has shined upon us once again. And so, yes, let's celebrate it and find joy in the day. What a blessing. Dr. Niesha here, and thank you for joining me once again on Your Story Does Not Define You, the podcast. If this is your first time tuning in, I want to welcome you and say thank you so much for listening in. It's always a blessing to have you join me on this podcast. And I would love for you to subscribe to the podcast and share it with your friend. Look, we are trying to make this global so everyone can benefit from this platform, as we all need to hear and share our stories, as telling our stories are freeing and provide so much healing. So, what is your vibe today? Because remember, you decide your vibe. What emotional state or mood are you in today? Did you do your self check today and check your temperature? Well, for me, I did. And I would like to say that my vibe today, for the most part, is overjoyed and feeling a little tired. I started my day off this morning pretty well, and then it got a little rocky emotionally and mentally. And then I was able to put it back together. So, my vibe right now is just feeling overjoyed and a little tired. It's been a fulfilling day and a fulfilling week, and I'm definitely looking forward to engaging in some time to rest and do some self-care. For me, one of the things that I really, really enjoy and find peace in is sitting outside in my backyard. I love my backyard. It's very quiet and peaceful. And I love just sitting by the water, by my swimming pool, and just enjoying nature and enjoying the sunshine and soaking up all the vitamin D. So that's one thing that I'm really, really looking forward to, is being able to just have some time to myself in my personal space and be outside, be outside in my backyard and, yeah, do some self care. But today I want to talk to you about a very sensitive topic that has been showing up in a lot of spaces that I have been in lately, and that is grief and loss. There are so many people in the world dealing with grief and loss in so many capacities. And I have had several people reaching out to me about grief and loss. And most recently, one of my good friends shared with me the other day that a friend of hers ended their life by suicide. And that really saddened me. And it really made my heart heavy just to hear that. And my heart really goes out to that person's loved ones and friends, because I can't even imagine how they are even able to process that. I know sometimes when we hear about people ending their lives by suicide, I don't even think our minds can even fathom the reason why they made that decision and what was the thing that really pushed them over the edge until they got to the point that they thought that the best decision for their life was to end their lives. So my heart really goes out to families and friends of people who ended their life by suicide, because I know that, again, that is something so difficult to process. So I really just want to be able to use this space to talk about grief and loss. I've recently done some live appearances and discussions on how to navigate through the grief and loss process, as well as how to understand someone else's grief and loss. And furthermore, how to show up for them in those spaces and support them, even when it's not welcome. And sometimes at the price of you feeling uncomfortable emotions and also feeling rejected. It's never easy losing something or someone, and navigating through those severely overwhelming emotions can be very scary and difficult. Sometimes it's hard to put words to how you feel or how someone else feels, and is often referred to as the tangled ball of grief. And I really feel like this reference just tries to put a description to how someone feels when they are attempting to process what exactly they are feeling and experiencing when they are going through a loss. And oftentimes, when I'm in my therapy sessions, I use the Tango Ball of Grief worksheet to give to my clients to help them to visually see what it actually looks like on a piece of paper, to kind of help them to get an idea of how to imagine what it feels like when a person is going through grief. So I just feel like one of the things that has been so important is that helping people to realize that our grief and whatever we go through in life, our bodies will give us a signal to let us know that something is going on. So, as we are processing grief looks very different for everyone because some losses are almost unbearable and it affects every aspect of our being. So, not just our bodies, but our minds and spirit. So, a way to look at this is I want you to try to imagine in your mind, get a picture in your mind of something that is tangled. I want you to visually try to think of something that is tangled and that you're trying to untangle. And I want you to think about when you are trying to untangle something and trying to figure out how to straighten it out, I want you to think about what feelings and emotions that you experience when this happens. So, for me, when I am trying to untangle something, for example, like one of my necklaces, if it gets knotted, I'm trying to use a safety pin, trying to get it untangled and trying to get it unstuck so that I can wear my necklace for the day. And I know that sometimes for me, it's very confusing because when I think that I have it figured out, I don't. It's mentally time consuming because it's taking up all my time. And so mentally, I'm feeling overwhelmed and it's very frustrating. So, as I use the analogy of trying to untangle my necklace, whatever mental picture you came up with, I just want you to think about some of the feelings that you felt when you were trying to untangle something. And I want you to use that analogy and compare it to grief because when it comes to grief, it's just like that. It's a tangled ball of emotions that you were trying to figure out how to process and how to get through. So, I want to take some time and talk about all of the emotions that can be associated with grief and loss and how to process grief and loss and get to a place where you can find acceptance and not hurt as much. And I also want to discuss how to support others who are grieving and offer you some recommendations and strategies on how to show up for them in a way that comforts them and at the same time also makes you feel good while doing it. So let's start with giving a detailed definition of grief and loss. And I feel like to best understand it, we have to know that grief is an emotional release after we experience a loss of someone or something. Grief is the emotion that we feel after the loss. And in grief lies so many other emotions and feelings and emotions such as pain, rage, guilt, sadness, anxiety, depression, anguish, resentment, fear, envy, jealousy, anger, helplessness, betrayal, loneliness, confusion, sorrow, disappointment, bitterness, dread, abandonment, and so much more. But in the center of it all is denial. It's so hard to wrap our minds around the fact of losing valuable things, people, relationships, jobs, identities, independence, normalcy. It's so hard to wrap our minds around the fact that we have been in a marriage for 20 years, for 30 years, for 40 years. And after all those years, our marriage is ending. It is so hard to wrap our minds around the fact that we have been on a job for 30 years, for 50 years, and to see that, okay, we're no longer going to be employed at this job because we got fired or because we transitioned and we retired and we don't have to go to this place of employment anymore. It's so hard to wrap our minds around the fact that we have loved ones who are still in the land of the living. However, for whatever reason, they're not functioning the same as they have previously because of sickness, because of illness, or because of a life changing event. This is where the denial comes in. It's hard to wrap our minds around if you are a mother and you have carried your child for the duration of a pregnancy, and prior to you giving birth of the child did not survive, or either you having to give birth to a stillborn and not being able to see your child live a life of fulfillment and not being able to watch them grow up to adulthood. It's so hard to wrap your mind around those feelings. So when we think about grief, denial is very present when we experience a loss. So I was talking to one of my friends the other day about the loss of her sister who died when she was about 6 months old. And this death happened several years ago. And when I was talking to my friend, and as she started describing to me how she felt during the time of her loss, because my question to her was, have you ever experienced a loss that you felt was really significant to you? And she answered my question by telling me about her sister. And during the process of her talking to me and sharing her feelings and emotions, she became very tearful and very emotional during the conversation. And after she got done talking, I asked her a question. And my question to her was the loss that you experienced, it must have been very hard. And based on what you've telling me and what you're sharing with me, it sounded like the grief that you experienced was very crippling and debilitating for you at the time. And she agreed. So what I thought about was that her loss happened several years ago, and her sister died when she was a baby. And still to this day, she still has feelings and emotions that rise up when she talks about her sister. As we continued on with the conversation, she further described to me that initially, when it first happened, she had so many questions for her mother and God at the time, and was uneasy about her sister passing away because she really just couldn't fathom in her mind how would God allow her 6-month-old sister to die and to pass away. And so she really struggled with that because at the time she was a little bit younger and I believe she was a teenager. So can you imagine having questions and wanting to know, like, why did this happen, or how did this person's life end so soon? So talking to her today, one of the things that I also noticed was that even though she became emotional and tearful during the conversation, she was able to talk about her sister and how she missed her and share memories about her, but from a different emotional space. So, where initially it was crippling and debilitating, that now it's still hurtful. It still hurts and she still gets emotional. However, she can talk about it more comfortable and from a place of peace because she's gotten to a place where she has been able to accept the loss of her sister, even in the midst of her questions, but be able to still move on with her life. So it made me think about me and how I lost my father almost 2 years ago. And I too get tearful and emotional talking about him to people. Even though at the time he was sick, he had dementia and some other health issues going on. And me and my family knew that at some point that it was going to happen eventually, and we didn't know when it would happen. However, even though we knew that it would happen eventually, it still hurt and it was very painful. And still to this day, it's a sensitive topic for me. And one of the reasons that is because I really felt that at the time that my dad passed away, I had to suppress some of my feelings and emotions to handle funeral arrangements and funeral logistics. And after everything was said and done, after it was the funeral was over and we buried my dad, I felt like I had to just pick up my life and continue life as usual before he passed, because my mom was ill and she still is. She has dementia and things still had to be done. Like she still had to be cared for and things still had to be done after the fact. And for me, I still had to make sure that my family was okay, that my children were okay, that my business was running smooth, and also that my family was taken care of, because my family really leaned to me for a lot of things and they depended on me for a lot of things. So it was almost like I had like a 5 minute grief break, that I had 5 minutes to grieve and that I had to pull it together and hold it together during this whole process and make sure that things went the way that they were supposed to go. But there was a lot of times during the process of preparing for my dad's funeral that I really had some tough moments. And even before the funeral, one of the tough moments for me was the night that the morning, because it was an early morning that he passed away, and the coroners came to the house to pick up his body. And I was the representative for the family to talk to them. And I kind of had a mental breakdown. And I remember one of my siblings telling me, you got to be strong, you got to hold it together, because I had to talk to these people. And so it was almost like, again, I had this 5 minute break of, okay, you can be emotional for this 5 minutes, but you got to pull it together because you got to talk to these people and things have to get done. So during the process, I remember a lot of times when I was making phone calls, trying to make arrangements, and trying to put the video presentation together, trying to get pictures together, trying to write the obituary. There were moments that I really felt like, okay, this is really tough. This is really hard. And I had moments where I cried. I cried in the process. There were times that I started something and I was just like, okay, I can't do this right now. I have to put this to the side and I'll come back to it. And after everything was said and done, about 6 months, for up to about 6 months after his passing, I really felt like I was all over the place. I it just seemed like I couldn't pull it together. I felt like I was just off, like even in my work, I was feeling overwhelmed. And I just feel like, okay, I just really need some space. Like I felt it in my body. I was feeling anxious. I was feeling on edge all the time because I just felt like I couldn't function and do things like I did before. I was really organized before, but now it was just like, okay, I wasn't organized. It just seemed like I couldn't sit still because I was always moving from one thing to the next, until finally I had to tell myself, girl, you got to get it together. You have to get it together. So that's when I decided to start making some changes in my life. I made some changes in my personal life. I made some changes in my business life. There were some things that I had to do where relationships that were so meaningful to me, and that were relationships that were long lasting relationships that were in my life, and people that have been in my life who have been very instrumental in my life, that I had to create boundaries and I had to part ways. to take care of me because I felt that at the time I wasn't getting the support that I needed, and they weren't showing up for me in the way that I needed them to. And so, in order for me to get back on track and allow myself to get back to a space where I needed to be, I had to separate myself and I had to do something different. And that different is that I had to put me first and start taking care of me until I can get myself back to the space that I needed to be. And in doing this really allowed me to be present with my emotions and allow myself to do what I needed to do to take care of me. So even now to this day, like I'm definitely in a better space emotionally, and I definitely do better with giving myself permission as often as I need to talk about my dad, to look at his pictures and videos and honor him and cry and remember him. And that really helps me, and it helps me to get through, especially when I'm having a rough day. So, I shared a little bit about my grief and I shared a little bit about my friend's grief. And as you see, grief looks different for everybody. And the severity of our grief is determined by the significance of our loss. And there's no timetable to determine how long that will last. It can be acute, which is basically just a shorter time period, or either it can be prolonged grief, also known as complicated grief, which means that it can last from months to years. So, if you can imagine or identify someone who you feel is in this space that seems like they've been grieving for months to years, and either they haven't received help or support, or either they refuse the help and support, and you've noticed that they seem to be isolating themselves more and maybe even feel a little down, or they look more depressed or sad, and you feel like the feelings that they're feeling have become chronic loneliness. And you notice that, okay, maybe where you guys spend more time together, you're no longer sharing same spaces anymore because they're not willing to um, show up and be present with you, and maybe you're trying to reach out to them and they're not giving you the response that they need. This is where I would say that a person could be dealing with chronic loneliness, which definitely as it continues can lead to a major depression. So how can we identify when we are experiencing grief after loss, or if someone else is experiencing grief after loss? So, one of the things that I would like to share is that the symptoms of grief overlap the symptoms of depression. So, a person going through grief can look like feelings of sadness, poor sleep, not being able to sleep, losing interest in doing things that they once enjoy, having digestive problems, stomach issues, anxiety, weight gain or weight loss, and even struggling with taking care of themselves from day to day, and just not feeling good in their body, and just feeling at a place where once they felt like life was welcoming them and they welcome life, that now they don't welcome life and they don't welcome the things that they once enjoyed. This is how you know when someone is going through the grief process from a loss, whatever that loss could be. So, when we go through the grief and loss process, we cycle through what is called the 5 stages of grief, and that is denial, anger, bargaining, depression, and acceptance. And the way that we can identify or remember what the stages of grief are is an acronym that I learned when I was in my graduate program, and that acronym is DABDA: denial, anger, bargaining, depression, and acceptance. So understand that these stages don't always happen in this order. Some say that there can be a 7 stage model which tends to be a little bit more in depth, expanding on the 5 stages of grief. But for the purpose of our conversation today, I really want to focus on the 5 stages of grief. So, as I talk about these 5 stages, I really want you to understand and know that, remember, these stages don't always happen in order, even though I'm going to expound on them a little bit in the order that they're listed in the 5 stages of grief. I do want you to know that sometimes things happen out of order and you may not experience all of the symptoms. So, if we look at denial, denial is the initial shock about the loss and sometimes helps with initially minimizing the pain of the loss as we process the reality of the loss. We tend to be in shock and disbelief. So, in this shock and disbelief, this is really where it minimizes the hurt and the pain initially. Because I think when we first lose something and we start the grief process, we really are not focused on the actual situation that has occurred because we're in such denial, we're in such disbelief. We really don't feel the pain right away because sometimes reality hasn't really set in. So, this is why denial seems to be in the center of the tangle ball of grief because, again, it's so shocking and we're in so disbelief about what has taken place that reality hasn't set in. So, we really haven't wrapped our mind around the fact that we have lost whatever it is. And anger happens because we are typically experiencing extreme discomfort and we use anger as an outlet. And it's so much easier to use anger as a way to say that we're scared or that we're fearful or that we are afraid or that we are confused. Because during the time of grief and during the time of loss, it's so hard to identify exactly what you are feeling. And we don't even always understand and know what feelings and emotions we are feeling. So we tend to use anger as a way to express ourselves. So with anger, sometimes we lash out and we're upset. And we're angry at God and we're angry at people and we're angry at the world because we are so upset about the loss that we have experienced. And underneath that anger is so many more feelings and emotions that's taken place. But anger is the way that we express these emotions because we haven't exactly identified what those emotions are. Bargaining happens often when we are in the state of desperation and are desperate to try to alleviate the pain. That we try to think of ways of how we could have changed the circumstances to prevent the loss from happening. So, bargaining is just that place where we are stuck in guilt and we are stuck in shame and trying to figure out, okay, how can we undo this? How can we stop this from happening? If we can rewind the time and we can change the hands of time, how can we prevent this loss from taking place? So when we look at bargaining, we're so desperate to get our loved one back, or we're so desperate for our relationship back, and we're so desperate to change things that we start having conversations with God and telling him things like, Lord, if you heal them, I promise I will do better. Or things like, God, if I'll stop being angry and upset if you bring them back. Or God, I promise I'll go to church if you just let my mom come back, or if you bring my child back. So during this stage, we often get stuck because the feelings and emotions that we are feeling are so overwhelming because we have such a feeling of helplessness and we are in a space where our hands are tied and we don't have control over the situation and we don't have control over the outcome. And we experience a lot of regret, guilt. We regret things that we said. We regret things that we did. We regret things that we didn't do. And this is a stage that I definitely can say that I have seen my clients who I've worked with have a more difficult time overcoming because they are so in so much hurt and pain about the loss and trying to figure out what could have been different to have prevented this. So these are times that a person can question themselves and they say things like, okay, if I had have called my dad and checked on him, then maybe he wouldn't have gotten an accident. Or if I had a went to the doctor earlier and had him checked on my baby, maybe my baby would have survived. Or things like, if I had a not let my son or my daughter go to that party, maybe they wouldn't have got killed. Or if I had just been a better wife and I had have done things at home for my husband, then maybe he wouldn't have cheated on me and maybe we would still be married. There's so many different examples that I can give of the what ifs and if I could have that people live with that is so overwhelming. So during bargaining, depression definitely kicks in. And depression happens when reality starts to set in and we face the fact of the situation and own up to the fact that the loss is not going to change. The loss feels more present and unavoidable, and we tend to withdraw and isolate from others. And the sadness grows, and it can be more difficult to go from day to day. So, remember earlier, I talked about how grief overlaps with depression because when you're going through the grief process, you feel a lot of feelings that mimic depression. And you also experience depression during the grief and loss process because it's part of the 5 stages of the process. And so, depression shows up in a lot of ways where we don't think. So, if a person experiences any symptoms of depression every day for a period of 2 weeks or longer, they can be clinically diagnosed with clinical depression. But when we think about grief and loss, when a person is diagnosed with certain symptoms that are the same as depression and they've experienced a loss, then they can be diagnosed with a bereavement diagnosis. And so we want to pay attention that during this depression state, whether it's you or whether it's somebody else, you want to be mindful if you notice that you are isolating yourself from other people, or if your loved one is isolating themselves from other people and really struggling to function from day to day. If you're struggling to be around your family, to be around your friends, to go to work, if waking up every day seems so hard, if taking a shower and getting dressed seems so hard because you just feel like after the loss, life is just not the same and I don't know how I can go on. This is how you know that you are really in a depressive state. So, you want to be mindful of where you're at and how you're feeling, and you want to make sure that you do things to help yourself get past this. So, when we're finally able to get to the last stage of acceptance, we are definitely in a better place. We no longer are struggling with the pain of the loss. However, we are at a place of peace and of more emotional stability. So, when we are in the acceptance stage, it doesn't mean that sadness and regret go away, because sadness and regret definitely still shows up here in the acceptance stage. However, because we are at a place of peace and we are more emotionally stable, we definitely can talk about the loss more, and the pain that we have felt initially is not so crippling and debilitating as it was before. So, when you're going through grief, how do you show up for yourself during grief? I would like to suggest that first and foremost, give yourself some grace. Give yourself some grace. Show yourself the same love and compassion and support that you would show someone else. Because navigating through grief and loss is not easy. And remember, it can be very crippling and debilitating initially. However, give yourself permission to take all the time that you need, as your grief is not predicated on what someone else thinks. So I know that when people experience grief because of a loss, you often hear people saying to them, okay, you need to just get over it. It's been a year now. It's been 2 years now. Why aren't you in a better mood? Like, you got to let it go. You need to move on. That is not the case. So I also hear that people say time heals every wound. Time definitely is on our side when it comes to healing from a loss and going through the grief process. However, to say that time heals every wound is not 100% correct. And the reason why I say that is that because we can have a year, we can have 2 years, we can have 3 years, we can have 10 years to have the time to be able to grieve a loss. However, if we are not being intentional during the time that we do have and work on our healing journey, then we are not going to heal. It doesn't matter how much time passes because you have to be taking the steps that are necessary for you to actually heal in order for time to be on your side. So, for example, if you lose, just say, a child and you continue to hold on to your child because you don't want to let your child go to the point where you are still dealing with emotional pain and hurt for years and years and years because you maybe are stuck in the bargaining stage, or maybe you're stuck in the anger stage, or maybe you're stuck in depression and you have not taken the necessary steps to get to acceptance. And just getting to acceptance doesn't mean that you forget about the child. It just means that you are at a place where you've come to the reality that you have lost the child. You realize that your child is not going to come back, and you know that life has to go on. So you're just more at peace and you're taking steps to feel more emotionally stable and mentally stable. And you are actually on your healing journey. So if you are not taking the steps that are necessary for you to be on your healing journey, then having time all the time in the world will not help you. So, showing up for yourself also means to take care of yourself during this grief process. Eat healthy, get plenty of rest, and do lots of self care. And that's just taking care of you, whatever that looks like for you. Self care is not selfish. So, make sure that whatever your self care looks like for you, those are the things that you want to do. If your grief is associated with the loss of a loved one, continue to honor the loss of that person and share memories and stories about them and talk about them often. Look at pictures of them. Think of funny memories and stories you shared. Find appreciation for the time you were graced to have them in your life, even if that was for one day or if that was for 100 years. Whatever time that God graced you to have that person in your life, still find a way to honor that person again, whether it was a day, whether it was 100 years. This is what helps with healing and getting you to a place of acceptance. One of the things is that you will never forget the person whom you lost. However, the pain can get better as you go through emotional healing by keeping them close to your heart. And what does that mean, to keep them close to your heart? Don't focus on how to get over the loss. However, always be present with your emotions and incorporate the loss into your life story by finding the joy in the hurt and the pain. And this is just using your story of the loss to help you, to push you every day. Incorporate your loved one into your life story, meaning talk about them, talk about what you went through, share with somebody else what you went through, talk about how you finally got to a place where you got on your healing journey and you started taking the necessary steps. And that is you finding joy in the hurt and the pain. And not only that, lean into your spirituality and God's grace. Remember, you are never alone, and God is always present with you. And know that we have comfort, and we have comfort in His Word. I love the scripture in Psalms 46:1 that tells us that God is our refuge and strength, and He's a very present help in trouble. And he gives us the authority, as it tells us in 1 Peter 5:7, to cast all our cares on him because he cares for us. So when I think about that, that just reminds me again that when I was dealing with the loss of my father, that those moments when I felt like I wasn't going to be able to make it. And those moments when I felt like I wasn't going to be able to get the things done that I needed to get done because my family was dependent on me, I really leaned to God for strength. And He was there for me. He held me up when I needed Him the most. I can't even count on my hand the number of times that I would lay in my bed and just look at pictures of my dad at the beginning, when he first passed. And I just would lay there, and my kids wouldn't be in my room, or nobody would be in my room. I just would be in here by myself. And I just would lay in the bed, and I remember just how the tears rolled down my eyes, and I cried, and I prayed and cried out to God. And it was during those times that He gave me strength, when I felt like, okay, Lord, when I can't be vulnerable around everybody else, or when I didn't feel like I could call somebody and have a conversation with them about how I felt like I can be honest with God and let Him know that I was sad because my dad wasn't going to be here anymore, because he was a very instrumental part of my life, and he was an instrumental part of who I am today, and just taught me so many things as a father, and taught me so many things as a minister. And I definitely give him the credit for just me being the woman that I am today. So we just have to understand that God is with us no matter what, and He cares for us. And not just in the loss of loved ones, but grief is also associated with the loss of um, relationships, the loss of a job, a friendship, the illness, the loss of a marriage, the loss of someone losing their independence, the loss of normalcy. And again, sometimes we lose the loss of a person even when they're alive. It makes me think about my friend again, and how she is kind of experiencing the loss of her mother. Her mother is alive, however, went through a sickness and went through a lot of different things. And she's definitely not in the same physical state or mental state that she was previously. And just dealing with that is still difficult for her and hard for her to wrap her mind around, because she has so many questions to God, and she's trying to understand, like, okay, Lord, how did she go from being my mom to being hospitalized for a long period of time, and getting to a place and a space to where I can't have the same conversations that I had with her before, and she's not physically able to do the things that she used to do. And how do you let her be in this state? So these are things that we have to think about, that grief and loss is just not the loss of losing a loved one, but the loss of so many other things. And we definitely want to allow ourselves to get to a place where we can heal. And if you can find that you continue to struggle with getting to a place where you feel like, okay, Dr. Niesha, I'm not quite at the acceptance stage yet. Like, I'm really struggling with the loss of this relationship, with the loss of my family member, with the loss of my independence. I'm really struggling in this place that I am, and I don't know where do I go from here. So, my recommendation to you would be to definitely seek out professional help from a therapist, or even attend a grief group if your loss is associated with a loved one. Sometimes we have to take the next step by seeking out professional help by trained individuals, licensed individuals like myself, that can help you navigate through this process and help you get to a place where you can finally get to the acceptance stage and be more at peace. So, I just want to talk about how to help you show up for others when they are dealing with grief. Like, how do you show up for others when they're dealing with grief? The first thing I want to say is that you understanding and knowing that it's so hard to find the right words to say to comfort someone when they're experiencing a loss. Also, know that our offering of comfort and support may seem unwanted and unappreciated at times. But in those times that you feel like, okay, here I am offering my support, I'm offering words of comfort, I'm offering myself, and it doesn't feel like it's been appreciated by the person, Don't take it personal. Please don't take it personal. Just give them the space that they need and continue to love them from a distance if you need to. And what do I mean by love them from a distance? Don't force it. You may want to help your friend and loved one so bad to help them get through it because you see that they're hurting, you see that they're dealing with pain, and you don't want them to be in that place of hurt and pain anymore. However, forcing them to process their feelings and emotions can do the opposite and be a barrier in their healing process. So please avoid trying to fix or rescue the person. We can have good intentions when we are trying to uplift someone or make them laugh. However, this sometimes can come across as the person feeling that their pain is not seen and heard. And one of the things that we want to do is that we want to validate them and support their process as long as it may take for them. We don't get to determine how long they go through this grieving process. However, we want to make sure that we are offering so much validation. And lastly, just make yourself accessible to the person, making the person aware that you are available when they are ready and you can provide the space that they need to grieve. And sometimes this can just look like listening and continuing to provide more and more validation and standing on the sideline quietly until they reach out to you. And when I say standing on the sideline quietly, it doesn't mean that you go away. If you don't hear from them, still reach out every now and then. Send them a text. I love you. I'm thinking about you. I hope all is well. I'm here for you. But just provide understanding and respect that if they're not ready to talk to you just yet, then that's okay. If they're not ready to go back to life that was normal for them, that's okay. Because when people are grieving, sometimes they have tunnel vision and they don't see the things the way that you see them. So instead of taking it personal and instead of judging them, just charge it to their heads and not their hearts and continue to show love. One thing that I have discovered is that love always wins. The Bible tells us that love covers a multitude of faults and love covers a multitude of sins. So instead of taking it personal, just continue to love because love always wins. So as we sit here and have this conversation, this definitely has been a heavy, sensitive topic. However, I'm so glad that we were able to have this conversation. This conversation really provided more healing for me as I shared about my dad and the loss of my dad, and just even talking about it today has really brought more healing to me. And as well as it's reminded me that healing is a continual process, it's something that takes time, and definitely that the transformation that takes place is a fundamental shift in our emotional and mental outlook on ourselves and our lives. So, healing takes place when we are ready to move forward and definitely are more confident in our ability to get through difficult and painful times in our lives and still remain well. So, today, I really just want to encourage you to give yourself permission to heal and give yourself permission to continue to heal. Validate your feelings and validate others' feelings because the grief process is like a tangled ball of grief, and there are so many emotions that we don't always understand. However, if we give ourselves permission to heal and continue to heal, we definitely can get through it. Be well, God's beautiful people. Until next time, Dr. Niesha Davis here. Have a blessed one.